toss questions in the chat. We'll go through all of them or as many of them as we can at the end, but I don't want to miss anything. I don't want to get behind and keep you all day long, as much as I would love to spend that long talking about this.
Yes.
But again, so job is to sit down every day, read through these government documents, also sit on the Medicare advisory group for the National Association of Benefits and Insurance Professionals, NABIP, formerly NAHU. So we've spent a lot of time reviewing this proposed rule when it came out back in December, reviewing comments that we submitted in February, and then now, of course, reviewing the final rule.
Yeah.
And Sadie, like you mentioned, this is not over and done with. You know, we have the final rule. It hit public inspection last week. It was added to the Federal Register this morning. It will be finally added to the Code of Federal Regulations in June, and then probably sometime after June, we will get what we call sub-regulatory guidance. So right now we've got CMS saying, here's what we're saying about these things. Later in the summer, we'll get sub-regulatory guidance that'll say, this is what we said, this is what we mean.
Yes. Okay.
And that's where some of the unanswered questions, I'll try to mention anything that's a little unclear or still has some questions about processes and things like that. I'll try to make mention of if I expect that to come out in sub-regulatory guidance later this year, but still in time for AEP.
Yes. So is it safe to say that all of the things that have been put out now, they're not going to retract any of this stuff? It's stuff that's going to happen. We'll just find out information later?
Correct. So
Okay.
at this point, it would be extremely unlikely any of these provisions get removed from the
Sure.
rule.
Never say never.
We
but
never
yeah.
say never, but it'd be extremely unlikely.
Okay.
Now, we will absolutely find out more information about how CMS plans to implement some of these changes. And, you know, like I said, they've already told us, here's what we say. Sub-regulatory guidance is, here's what we mean when we say that.
Yeah.
So that's what a lot of this is going to be. But again, keep pumping questions into the chat. We'll address those at the end. I'm going to hop right in. If you're following along on that link to the Federal Register, that is the finalized rule that was added to the Federal Register this morning. Again, hit public inspection last week. We'll be starting on page 115 and rolling through page 137 to go through these line by line, starting with section 1 on marketing materials. And again, I'm going through this line by line as presented in the Federal Register. So there's going to be a couple different sections on marketing materials that aren't always right next to each other, but we'll just go through it as they appear in the document.
And for those who just joined, that is the link that we have in the chat box. So in your control panel there for your webinar, if you click under chat, it's the Federal Register document that he's talking about. And then if you click under handouts, you'll be able to see the Senior Marketing Specialist quick FAQ sort of thing. But yeah, go ahead.
Absolutely. So again, with marketing materials, CMS made a couple of changes to how marketing materials get submitted for approval. The biggest one, TPMOs, third-party marketing organizations, which does still include agents and brokers. We are required to submit all marketing materials to CMS for approval. In the past, we have been able to submit them to CMS through the health plan management system. Plans were able to opt in or opt out of those. We could go back, we could edit, we could resubmit, and eventually get something approved. CMS is changing that process a little bit. We are required to submit all marketing materials still, but we are changing a couple things about the process that carriers will have to pre-approve any marketing materials before they go into the health plan management system for CMS approval and for those carriers to opt in. So if you're trying to create a marketing piece and you want to represent United Healthcare, Aetna, Humana, Cigna, any other carriers, each of those carriers is going to have to pre-approve what you have as that marketing piece before it actually goes into CMS. So you'll still work through us for this process. Your upline can help you submit these marketing pieces. We have the connections with all the carriers to get those submitted. Some of the carriers have already started this pre-review process. United Healthcare, for example, always wants to pre-review marketing materials before they end up in CMS's hands. Other carriers, it's going to be a change, and they may not even have a process in place yet to do that pre-review, but they'll be rolling those out as we get closer and closer to AEP. So you'll still submit everything to us. We'll kind of do that initial check, make sure everything looks good-ish as best as we can, and then we kind of throw it to the carriers for them to fight over, because every carrier may have a little different requirements. And that's one of the reasons that CMS is kind of pushing this more towards the carrier side first, because if you have a marketing piece and United Healthcare and Humana say this looks great, but Aetna says we want changes, you make those changes, then you have to submit it back to Humana and UHC, and then UHC says we don't like this, and so on and so forth. So rather than cluttering up the health plan management system with that, CMS says, listen, we want clean copy. When it gets to us, all we want is people saying yes.
Yeah.
Rather than having that kind of debate process going on within the health plan management system.
So to clarify, our agents will still submit to us.
Absolutely.
We submit to carriers.
Mhm.
Then once that has the good to go, then we submit to CMS.
Correct.
Okay. Sounds good.
Yep. So not a huge change, just, going to be a little tricky getting all those carriers coordinated.
Yes.
Another one that has been a big talking point is the use of the Medicare name marks and logos. That was something that was proposed back in December in the proposal, and really just kind of a general sense that CMS wants to strengthen those protections. It's already against regulation to use any Medicare names, marks, logos, anything like that in a way that could confuse a beneficiary, in a way that could imply that you're endorsed by or work for Medicare or anything like that. So they've just kind of added a general sense of strengthening those regulations. They've specifically called out the word Medicare, the Medicare name, HHS logos, and any other Medicare or HHS produced products and documents. The big one that got a lot of press is the Medicare card.
Mm-hmm.
We see a lot of marketing pieces that use that sample John Doe, John Smith Medicare card with the dummy number on it. And that was actually a big one, that we will not be permitted to use the Medicare card in any marketing without prior approval from CMS. This is the first chance that I get to recommend that sub-regulatory guidance. So CMS has not clearly defined what prior authorization means yet, whether that's going to be just through the HPMS, through the submission process, or whether there's going to be some additional qualification to use the Medicare card in your marketing. But as of right now, without approval, you cannot use the Medicare card in any of your marketing. And back up half a second, another thing we should have opened up with, obviously this is called the 2024 rule for a reason. It affects 2024 plan sales and beyond. So all of these new rules take effect September 30th. So when we start marketing 2024 plans on October 1st, that's when all of this kicks in. Everything else stays exactly the same up until that point. So not that you need to go pull anything off the market today, but start phasing out anything using the Medicare card, or more importantly, if you want to continue using the Medicare card, be working with us to make sure that it's in an approved manner.
Yes, exactly. And you said this year it's September 30th, right?
Yes.
So that's different from last year. Last year was October 1st.
Yep.
And this year it's September 30th. So it's a small difference, but it can make a big difference. So just keep that in mind.
Yep. And I think it was really just CMS trying to remove all doubt of, maybe someone said, well, is it October 1st inclusive or exclusive? And maybe I can get away with mailing something out on October 1st. And, so I think they kicked it back to September 30th just to remove any doubt. And make that a little easier for everybody. And again, keep adding questions. We will address them all at the end. I just don't want to get bogged down and miss something. Number 3 and 4 on the list are two very closely related things regarding to how we advertise benefits and things like that. Everyone knows we've always had a prohibition against unsupported superlatives. Can't say things like best plan.
Right.
And that is something that CMS is taking up and kind of trying to strengthen those protections. So they've made some new rules about unsubstantiated statements. including those in taglines, slogans, things like that. Absolutely no unsubstantiated statements. Must be able to use current or prior plan year data to support any statements. We saw a lot of marketing in years past saying things like largest network, biggest benefits, things like that, highest rated, most enrolled in, things like that. A lot of stuff on the plan side or from some of these more unscrupulous TPMOs. You cannot market things in that manner unless you have actual data that you can cite and source and back it up. So that's going to be the big thing. Any marketing materials will have to have actual documentation for any of those things, claiming largest network, top plan in your area, things like that.
Sure.
The other provision in section 4 is you cannot advertise benefits that are not available in the area the ad is being presented. So this is one we've kind of been asking for a long time. We don't need to see these, $144 give back ads in areas where there are no $144 give back plans. Mm-hmm. So this is really what this particular rule is targeting. Can't advertise benefits in an area they're not available, and this could be anything from dental to gym memberships to specific copays to any number of things.
Sure. Yeah.
And really the reason behind that is it could be considered kind of a bait and switch type thing. Right. You may offer this one benefit, but if it's not actually available, you're drawing people in with a false promise of benefits.
Right.
So that's one of the big reasons that CMS is looking at this. There are a couple of kind of reasonable exceptions to this rule. For example, let's say you take out a newspaper ad and you're marketing benefits there in your hometown newspaper. There's no way for you to know that somebody in Georgia subscribes to that newspaper by mail because that's where they grew up and they still want to keep an eye on the town.
Right.
That is a reasonable accommodation for things like that.
Yeah.
So there are a couple limited exceptions for cases like that, but a lot of it's going to be kind of good faith efforts. You'll expect carriers to have a lot more guidance on these things like that. Mm-hmm. Carrier names, rolling on to number 5, and again, keep putting those questions in. We'll get to all of them here at the end. Marketing materials are, CMS is making a real effort to make marketing materials a lot more specific. And I also want to clarify something that I probably should have done at the beginning. When I say marketing materials, I'm talking very specifically about what CMS defines as a marketing material, yes. Not what normal people would consider marketing materials. There are a lot of things that you may use as a marketing material, like a business card, for example, that may actually be a communications material under CMS definitions. So when I say marketing, I mean the CMS definition of marketing materials. But what CMS is trying to do in a lot of cases is kind of narrow the gap and draw more things that agents or carriers may create into that bucket that is marketing materials, because they want more oversight. They want more review of what's going out to beneficiaries. So this big one is that marketing pieces must identify the plans they represent. So if you are going to market any kind of benefits, those must be marketed specifically. So for example, super common, everyone has seen ads that say may offer dental, vision, and hearing in your plans, may offer dental, vision, and hearing in your area. That is no longer going to be acceptable marketing. You will need to mention specific dollar amounts so you can tie that to a specific plan or plans that offer those benefits in your area, so those can be submitted. So that specificity is going to draw a lot of things that maybe used to be considered communications and didn't have to go through the approval process. It's going to draw them into that marketing bucket and require them to be submitted for approval. So you'll have to mention carriers if you are going to mention any kind of benefits, and you'll have to be specific about those benefits that are being mentioned. Really, the idea here is to make sure plans are taking responsibility for the materials that are marketing their products. Basically saying, you guys don't get to turn a blind eye anymore. Yeah. You have to know what's out there marketing your products, and you have to say, yeah, we'll own this. We approve of this piece that's being used to market our plans.
Sure. Yeah.
Couple other things, some changes to disclaimers and things like that in relation to adding carrier names to marketing pieces and other disclaimers. For everyone who's argued over it with me in the past, it is finally black and white, codified in law, 12-point font on print materials. Disclaimers have to be 12-point font at minimum on print, TV, online, social media, things like that. The standard now is that if you are presenting a phone number or email to call or email, or if you're presenting any benefits, the disclaimers and carrier names must be present in the same font size as the phone number and for the entire ad. So you can't just flash it at the beginning, flash it at the end.
Yeah.
It has to be present for the entire ad. It has to be in the same font size as the phone number. That's for TV, online, social. For things where you're maybe speaking that disclaimer aloud, it has to be read at the same speed and cadence as any phone number or contact info. You can't just chipmunk it at the end and call it good.
Calling your auctioneer friend, you know, have them say it real quick at the beginning.
So that is not going to be permitted, and that goes for radio as well as TV and online.
Okay.
So continuing with the theme of some actual marketing materials or marketing tactics, will not be able to market anything that is savings that are not realized. So what that really means is you can't market things that don't actually have anything to do with plan choice. We saw a lot of ads in the past couple of years that were marketing things like, you know, saving $9,000 a year on your medical costs, that were actually comparing savings compared to an uninsured person. So you can't market savings based on what an uninsured person's savings would be. You have to market savings compared to people in other plans or people, you know, in other types of coverage.
Yeah.
You can't just use an uninsured person as the baseline.
Sure. Could you give an example of
Sure.
like what
so
you're talking about?
Probably one of the biggest one is we saw a lot of marketing, for example, for D-SNP plans that would market things like $5,000 a year in savings. In reality, that savings that was being mentioned was the savings from that enrollee not paying their Part B premiums, and drug savings through other program, you know, Medicare savings programs, extra help, things like that.
Yes.
Based on national averages, things that don't actually depend. It doesn't matter what plan they're in.
Yeah.
They're going to experience those savings compared to an uninsured person.
Got it.
So we cannot market things based on people without drug coverage or, you know, without Medicaid. If that's already a requirement for that plan, would be that they have Medicaid.
Sure.
Getting in a little bit into the lead generation world, we're on item number 7 for anyone following along on the Federal Register. No door-to-door solicitation has been a rule for a long time for Medicare Advantage and Part D, but we are strengthening and changing that rule a little bit. In the past, a lot of agents may have, say, bought some leads or, you know, done a mailer, and they got that reply card, they got permission to contact, and you can't get them on the phone, they won't respond to an email, you sent them a birthday card, nothing. So maybe you want to go out and knock on their door. Can't do it.
Can't do it.
A permission to contact or business reply card, a lead card, is not considered a valid reason to show up unannounced on someone's doorstep. That is prohibited, unsolicited contact. You cannot show up at someone's home without a preset appointment. So definitely clarifies the rules on that. I have long been a proponent for kind of getting rid of door knocking. I know there's still some people out there that do it. Some folks that'll say, I'm door knocking med sups. That's fantastic. You do you. I'm not going to tell you you can't do it. I'm just saying it's a risky game to play, and I do not recommend it. So again, to clarify this, no showing up unannounced at a client's home. You must have a prior set appointment to approach a beneficiary's home.
You have to have that appointment on the books. They have to know that you're coming.
They have to know you're coming.
Yeah. Okay.
Exactly. Yep. So number 8 is a little bit of a nebulous rule that mostly affects plans, but we may see sub-regulatory guidance that says that it affects agents, and it actually could be a pretty big deal. Right now, currently, plans are required to allow one-time clients the opportunity to opt out of plan business. What this means is being contacted by the plan to discuss maybe other products and things like that. It does not mean the plan cannot contact them about their currently enrolled plan and things like ID cards and changes and stuff
Sure.
like that. But it does mean they would not be able to reach out about other plan business, so other lines of business that carrier offers or something like that. Under this new rule, plans will be required annually in writing to provide the ability to opt out of that marketing of other products offered by the carrier. And the big question here is this just strictly plans, or do agents also need to provide this? The way it's written, I'm inclined to believe it will just be the plans themselves, because it says plans and plan sponsors rather than TPMOs, which is what I would expect if it were going to be specifically agent directed. But again, I hesitate to say anything super definitive until we get more of the sub-regulatory guidance on that one. The good news for agents, this is, and granted, I want to say our carrier partners have done a really good job over the past few years to put new systems in place to do things like protect agent of record and reduce the number of times that a client may call in with a support issue and end up on a new plan with that same carrier.
Right, yeah.
But this annual opt-out would mean that if someone is opted out of plan business, the carriers flat would not be able to transfer them to a sales division if they call in with a support. So it would drastically cut down on any of that, the carrier internal folks switching any of your clients. And again, even if you are getting AOR protected, that can sometimes be problematic. So for an agent perspective, that could actually be a pretty big win for us.
So how will, this might be a silly question, but how will the clients know that that's an option that they have?
Sure.
Will the agents, and this might not be something we know now, but will agents be able to tell their clients like, hey, this is an option, you can opt out of this?
Sure. So yeah, so carriers, like I said, they're going to be required to provide that in writing on an annual basis.
Yes. Okay.
So typically maybe with an annual notice of change letter, maybe in the welcome packet, CMS has left it up to plan discretion exactly how they identify that annual notice.
Okay.
It could be a single letter that gets mailed to the client each year.
Got it.
It could be in that welcome packet, in that ANOC, something along those lines. CMS is leaving it a little bit up to their discretion.
Okay.
But yes, absolutely. Agents can educate clients on that. We definitely don't want clients opting out just for no reason, because there are valid reasons to be able to do this.
Sure.
And again, until we see the sub-regulatory guidance and whether this applies to agents or not, let's hold our horses and wait for more info. Next couple ones are going to go into educational events. The biggest things are prohibitions on collecting scope of appointments at educational events. Originally, there was a proposal to prohibit the collection of pretty much any beneficiary information at educational events. And if you've been around in the industry for a while, it's really going to flash you back to like 2017 and prior, because several of the provisions in this rule are really just kind of bringing back some of the greatest hits of CMS, so to speak. And this is definitely one of them. So starting September 30th, you will not be able to collect a scope of appointment or to set a future individual marketing appointment with a client at an educational event. You can, if they request it, allow them to fill out a business reply card, permission to contact form, but no scopes of appointment, no setting appointments. And as we'll talk about later, expect a lot more secret shopping this AEP. So don't try to be sly and try to schedule a phone call, be like, oh, I'll call you about this, nah, do it by the rule book. It'll all work out for everybody. The other thing on educational events is they are prohibiting a sales event from occurring in the same location to include the same room or even building within 12 hours of an educational event occurring. So we saw a lot of times where someone may have, say, a steak dinner educational seminar, 15-minute break, sales presentation right afterwards. Obviously, definitely the exception to the rule. There's a lot of folks doing things perfectly above board. And right now today, that is still technically perfectly above board. But the concern for CMS was people don't have enough time to potentially opt out of that sales presentation. They may feel pressured into that sales presentation, things like that. So no sales events within 12 hours of educational events at the same location. This next one, again, number 11 for anyone following along on the Federal Register, is kind of the doozy that a lot of people have been talking about since December. CMS has elected to bring back the 48-hour scope of appointment rule. So you will now be required to have a signed scope of appointment 48 hours or more before you're able to present or enroll a client into a plan. And again, as I said, anyone who's been in the business for a while, this is back to 2017 and prior. When I started in the business as an agent, 48-hour scope was the rule of law, and that was what we had to do. This is really going back to that. I will say it is actually a little bit easier than it was back then. So we do still have a carve out for someone who physically walks into your office unannounced and wants to have a meeting. So you do still have that walk-in provision. You also have a carve out for the last 4 days of an election period. So if you are at, say, December 4th, 5th, 6th, or 7th, and someone says, I need to meet with you, you still have to have a scope of appointment, absolutely, but that 48-hour rule is waived. Same thing if they're in the last 4 days of their IEP or of OEP or of losing group or something like that. The last 4 days of that valid election period for that client is also a way to waive that 48-hour rule.
So to tie this back to, giving an example of some stuff that we've just talked about, door knocking, that means, hey, you still can't, even if you have an appointment set up, you still have to have that scope signed 48 hours in advance. So you can't call, be on the phone and be like, hey, I'm going to come over. We'll sign the scope real quick and talk about it. It's got to be 2 days in advance.
2 days in advance. Okay. Yep. So 2 days in advance. Listen, there's a ton of ways to get a scope. There's like 97 ways to collect a scope of appointment. It's really not that difficult these days. My clients don't text. My clients don't have email. My clients don't have internet. That's great. Do a voice scope. There's like 9 different ways to do a voice scope of appointment. Absolutely get those done. Should not be a big deal. In this day and age, unlike back in 2016, we have the technology. There's a million ways to get a scope in a compliant manner. So definitely want to make sure we're getting those scopes. And again, like the big win for agents here that have been, say, complaining about the unscrupulous call centers is that walk-in provision is only in person. Someone has to walk in to your kiosk, to your office, things like that. And that's when they can use that 48-hour exception. But a lot of folks are still going to have to use that 48-hour rule for the regular clients that want to schedule an appointment, for people who call in and things like that.
So if a client walks into your office, you have an office building, they walk in and they say, hey, I want to talk about this. They're good to go?
Good to go. Still need the scope.
Still need the scope.
Indicate walk in, you're in good shape.
Got it.
Before someone says it, someone's going to make the joke eventually, well, I'm about to have a lot of walk-ins. Sure, you can play that game, but again, going to be a lot of secret shopping going on. Last AEP, a lot of people don't realize it, but CMS did over 40,000 secret shopping, calls and meetings and things like that, with them requiring that of the carriers as well. That is going to be an even bigger deal this year, I suspect. So,
and we're talking in person, over the phone, and in all the different ways, there's going to be secret shoppers, right?
Absolutely.
So it's not just something that you have to worry about whenever you're face to face. It's something that you need to be aware of in any way that you can get a client and you're having those meetings with clients.
Absolutely. And again, keep plugging in those questions. We'll address them all, or as many as we can at the end. Scope of appointment timeline, there's always been a lot of kind of nebulous information about how long is a scope of appointment good for. That's a question we get asked all the time.
Mm-hmm.
Prior to now, it was a little nebulous. It would say like, you know, it was good for the enrollment period it was signed for, or it's good until you used it. Or if you asked SilverScript, it was good for 14 days, but that was actually not entirely true either. And it was just the way their system worked. So now we do have finally the hard and fast rule. You do still need that scope of appointment 48 hours prior to presenting a plan or enrolling someone in a plan. And you do need a new scope of appointment for each appointment you conduct. But if you say, have someone call you on December 10th and you have them sign a scope because they wish they made a change, but they didn't know they could, that scope is good for 12 months. So a scope is good for 12 months or until you use it in the presentation of a plan. Number 13 is a real quick one. This is a big win for clients. It doesn't really have much to do with agents, but it requires carriers to upgrade their provider directories to make them searchable by all fields required by CMS to be listed, and adds a new field for cultural competency and linguistics. So you will be able to search providers in more ways than ever for your clients, including what languages they speak, address, physical locations that they are present at, name, and anything else that is required by CMS in those documents.
Hey, that is nice.
That's a big one. That's a good deal for clients.
That is a big deal for clients, because there's a lot of people out there that are like, hey, I just want to know if I can see my doctor.
Yeah,
right? Can I see
absolutely.
the people I want to see? And that's something that, you know, we've talked about here. Well, you can use this or you can do this because this one doesn't,
Sure.
you know, you can't search your providers, stuff like that. So honestly, it might make it it will make it a lot easier on the agent end, but just, really big thing for those clients.
Absolutely. Section 14 of the rule goes through what's called the pre-enrollment checklist, the PECL, and the effect on current coverage provision that Medicare is adding to that. So we've always had pre-enrollment checklists. They've always been kind of that thing stuffed in the back of an enrollment book that a lot of people didn't necessarily pay attention to. We're changing some requirements on that pre-enrollment checklist. CMS will require agents to complete and review that pre-enrollment checklist and get an affirmative response that someone understands it on all telephonic enrollments. If you're enrolling people over the phone, whether you're in a call center or sitting in your garage or just have someone with a bum leg that can't get into the office or something like that, if you're doing any kind of telephonic enrollments, you will be required to go through that pre-enrollment checklist and get an affirmative response on it. If you are meeting with people in person, you will be required to provide that pre-enrollment checklist to them with their other plan documents as is already required. The big thing here is that there is going to be a new requirement on that pre-enrollment checklist that will require agents to disclose how enrolling in the plan they are presenting will affect other health insurance, such as things like TRICARE, or if they're in a different MA plan currently, or if they have Indian Health Service or any other type of other coverage that may be impacted by this new plan that they're being promoted. So some changes to that, and you'll see in some later things that that definitely a lot more emphasis put on making sure agents are thoroughly covering everything a client should know before enrolling them in a plan.
Mm-hmm.
And listen, if you followed us, if you followed our selling process and kind of our walkthroughs of how to present plans, you're probably already doing a lot of the right things. This is just going to give you literally a checklist to go through and some things that you need to make sure you're addressing with clients. So it's going to make it very easy to do the right thing. You'll literally have a checklist, so a lot less what ifs and what abouts.
Yes.
A couple of other things, these next couple, 15 and 16, again, really plan focused, not a huge agent impact. Standardizing the way medical benefits are listed in a summary of benefits. Carriers are required to use a standard layout, what order they present benefits in, and it is required to be in the top half of the first page of the summary of benefits. The idea here from CMS is beneficiaries will be able to more accurately and more easily compare one plan to another if that's a standardized format in the summary of benefits. So should make that plan comparison for your clients and for you a lot easier. Same thing with number 16, plan non-renewal notices. CMS has proposed to create that as a model material, meaning one that has a standardized format for any plans that are being non-renewed. And then that notice needs to go out to beneficiaries. Again, really not a huge agent impact. It's just gonna unify what that letter looks like across all plans rather than letting each one create their own and have to submit it for approval and so on and so on. This is really about paperwork at CMS. Doesn't have much to do with agents in most cases.
But hey, it'll help with, you know, setting expectations with your clients. This is what you can look for.
Absolutely.
This is how, you know, so it is something that can make an agent's life a little bit easier and also just help them communicate better with their clients better. But yeah.
Absolutely.
Good to know.
Absolutely. So number 17, now we're getting into some of the big ones. So let's talk about this disclaimer that we have all come to know and love. The wonderful, wonderful marketing disclaimer that goes on all of our marketing pieces, that goes on our website, in our email signature, and in the first minute of all of our phone calls. We're making some changes. Originally, they proposed some changes that were going to be pretty untenable. We're going to have to list off every carrier that we represented, and it was going to make this, 15-second disclaimer about a minute and a half long, which was a problem if we had to read it in the first minute. But we did see some revisions to that proposal. One of the things that did stick is that you now have to mention SHIP, state health insurance programs, as one of the resources for clients. So looking at, you can call 1-800-MEDICARE, go to medicare.gov, or reach out to your state health insurance program for information on all of your options. Also, they did amend this to, you're going to have to list plan numbers and the types of plans. So for example, it will read something along the lines of, we do not offer every plan in your area. We currently represent X number of organizations that offer X number of plans in your area. It also applies to everyone now. Previously, it did not apply to entities that offered only one plan or that did truly offer every plan option. It does apply to everyone. If they only offer one plan, they're expected to identify who it is. If they offer every plan in their area, they just don't have to read that "we do not offer every plan in your area" part. They still have to say we represent X number of organizations offering X number of plans in your area. The big question that I have gotten numerous times already is, of course, okay, so that number can be different, county to county to county.
Yep.
This is one of those great places where I get to say, let's see what the sub-regulatory guidance is.
Yeah.
Frankly, we do not know. I suspect there will be some provisions to make it as accurate as possible, especially if you look at the previous provisions requiring you to list plans on marketing materials and make sure you're not advertising benefits in an area they're not available. My concern here with this is if you're supposed to, let's say in total, across the country, you work in multiple states, you're contracted with, say, 27 carriers, and across those 10 states, they offer 145 plans. You can't call someone up in Callaway County, Missouri, and say, I represent 27 plans that offer 145 plans in your area, when there's only like 6 carriers that offer 12 plans. So I think that's going to be kind of the big sticking point, the big catch with exactly how this gets implemented. But again, sub-regulatory guidance is the name of the game, and we'll learn more and let you know as soon as we do. Again, expect that probably mid to late summer. We're talking July, August, maybe as late as September. CMS has issued sub-regulatory guidance in the middle of AEP in the past, but I don't think they're trying to do a gotcha with anybody on this. They're going to provide more info.
Yeah, absolutely.
Number 18 on the docket, if anyone's following along on the Federal Register, medication review and safe disposal information. This one may affect agents, as some of you may have seen in the past. As part of the health assessments, United Healthcare is already requiring information on safe disposal of medications as a part of that health assessment. This would just require that anyone who is getting a medication review through a medication therapy management system that a carrier is offering, you see this a lot with chronic needs patients and things like that. If they are doing that, they have to provide that written summary of the medication review to the beneficiary, and they also have to provide information on where and how to safely dispose of unused medications. So It may impact agents a little bit in the sense that it may be your responsibility to provide some of that information, but this is really a lot more of a plan directed. This is, when that nurse comes into the home of your client and goes through and does some medication coaching with them, and they'll provide an outline of that medication management and review program, and then information on safe disposal. So not likely to be a huge agent impact, but still for sure something to keep an eye on.
Yeah.
19 goes into something we've been talking about for a while now, that plans are going to be required to create a much more robust management and oversight system. So this is currently item 19. If you're following along in the register, that's probably somewhere in like the 128 to 130 range, page number wise. But the big thing is CMS says, hey, right now we get complaints, we send them to you, you review them. That's great, but it's not enough. You're very reactive. You're waiting on problems to happen before you look at them. And as we've talked about in past webinars, the biggest problem with that is that there is such a delay.
Right.
Such a delay. It can often be as much as 6 months from the time someone completes an unwilling enrollment to the time that they file a complaint, because they may not realize it for a while.
Well, yeah.
They may not use it, not find out until they go to the doctor and have issues.
Yeah.
They may, the most common thing, they may try other methods of remediation before they finally call and file a complaint. If anyone has ever looked at the bell curve of complaints, highest complaint numbers, May, June, July, August, because no one complains in January, February, and March when they can just use OEP to switch.
Right.
No one complains in November and December when they've just switched with AEP and it's going to be fixed.
Yeah.
Complaints are kind of that last resort for a lot of folks. But definitely something to keep an eye on. They're going to be required to obviously continue reviewing grievances and complaints, do random call auditing, do a lot more of secret shopping in person, online, over the phone, your websites, your lead forms. If you've got it and it's designed to draw beneficiaries to you, people will be secret shopping it, both CMS and the carriers. And then a little bit, and again, this is going to be a sub-regulatory guidance thing that the carriers will probably fight out with CMS, but a more stringent requirement to report non-compliance to CMS. Typically right now, a lot of the reporting kind of goes by the wayside, it seems, and really the only thing that gets reported is anytime someone is terminated for cause, which is extremely rare. This may require reporting any complaints or remediations to CMS, which is what agents have been asking for. This is how you kind of get a direct accounting of which agents are the bad actors and how to kind of roll through and figure out how to deal with that.
Real quick, we
yes.
did have a few people pop on here that said, oh, I joined late. Can I watch this later? Yes, this is being recorded. We will be sending it our follow-up email. We're also answering all of our questions at the very end, so please feel free to throw in your questions. We see them. We have them right here in front of us. We just want to make sure that we get all of your questions answered. So it will be recorded, sent to you in a follow-up email, and we're answering questions at the end. Cool.
Absolutely. We're down to the last three, and then we'll get into the questions. I promise. Number 20 is kind of a big deal. It's required elements prior to enrollment. CMS will literally be creating a checklist. This is in addition to the pre-enrollment checklist of topics that an agent must review with a client before they can begin an enrollment process. So these will be things like talking about your pharmacies and your networks and formularies and things like that. CMS has specifically said they will address the exact verbiage and the exact list in sub-regulatory guidance. So we can expect to see that again later this summer. But before you begin an enrollment, you will have a list of things you are required to go over with your client to make sure that they understand all of the factors that go into plan choice and make sure that you have enough information to actually help them make an informed decision on what plan might fit their needs. So again, some of this stuff, like I realize it's going to maybe lengthen some appointments. It's going to maybe be a little bit of a pain. but it makes this process really simple. It covers you really well as long as you're doing things by the books. It really eliminates the possibility of complaints in a lot of ways. So I think there's a lot of good info here. The last two sections have to do with call recordings. The big news that everyone should shout a sigh of relief with is that CMS did finalize the proposal that not all calls have to be recorded, only sales and enrollment calls need to be recorded and returned and retained. Doesn't apply to service calls. If someone calls in and needs a new ID card, if someone needs help finding a new doctor or a specialist or something like that. It also does not apply to appointment setting. It only applies to the actual presentation of a plan and the enrollment process. Now, the big thing here, I know there was a lot of discussions last year about people trying to opt out of call recordings. That is not an option. Someone can opt out of a call recording, but if they opt out, you must end the call and find a different way to enroll them and present the plan. If they're going to enroll over the phone, that has to be recorded. There's no way around it.
Now, that being said, whenever you were talking to our team about all of this stuff yesterday, this is when all the hands went up, and we just want to make sure. So the chain of enrollment, for a long time, we said, make sure you're recording everything because you don't know what calls will eventually lead to a Medicare Advantage or PDP sale. So what are your thoughts on that? What about the chain of enrollment?
Absolutely. So the definition of the chain of enrollment, as far as I can tell, has not changed. What CMS has changed is which calls are required to be recorded and retained. That said, I know all of you wonderful compliance abiding folks already have a really good call recording system set up and have been recording every call with beneficiaries. I definitely still recommend doing that. It's just a great CYA. It's a great thing to go back and look over if you forgot something, or if you want to use it for training, or just if someone has questions, or if you need to kind of recall something. It's going to be a great way to protect yourself regardless. The big thing for me is it's a lot easier to record every call, pull out those ones that you do need to save for 10 years than it is to remember to hit that record button every single time that you need to. So again, really recommend just recording everything, pulling out those sales and enrollment calls to make sure that you're saving those for the 10 years and then getting rid of the rest of them after a reasonable period of time. Last provision that CMS addressed is web-based meetings, Zoom calls, RingCentral, FaceTime, whatever platform you use for your virtual meetings. Those do count as calls. You must record and retain the audio portion. You don't have to retain the video, but you do have to retain the audio portion for, again, those sales and enrollment calls. So those still have to be kept and retained for 10 years. That is really the high points. Again, a lot of pages of regulatory guidance to go through. Anyone wants to read through it, I highly recommend it. But one of the big things that you probably did not hear me talk about, there was a single line in the proposed rule back in December that said TPMOs may not transmit or share or sell beneficiary data with other TPMOs. And that was a single line that struck terror into the heart of every lead vendor in existence. And Medicare said, we will not be discussing that at this time. We may look at it again in some other guidance. So they basically gave up on it. So lead vendors are safe-ish for now. Still going to have to file other materials and things like that. But the other reason is the Federal Communication Commission is currently doing a lot of work on lead generation and some major changes to that in all industries, not just Medicare. So I think CMS is kind of pulling the reins back on that one, let the FCC take care of it, and then see if they can make that workable for us as well. But that is kind of the end of the main content part. Everyone keep putting questions in. We're going to roll back up to the top. I know you all have been putting stuff in this whole time, and we'll answer as many of these as we can. Keep putting them in. I'll stay here as long as you want. I'm happy to, Sadie may have to leave, but I'll stick around all afternoon.
I'm here. Hey, I'm here.
But so First one, yay, compliance. Noah, thank you so much. You know it's my
Yay.
favorite thing. But let's see here. Can we still use the Medicare card picture in an educational seminar? So this may be one of those sub-regulatory guidance things, but the way it's written to me is you cannot use a Medicare card without prior CMS authorization. Again, we're still waiting to see, is that just marketing materials through the HPMS process? Is that through some separate process? There are still some unanswered questions. That's kind of one of them. The details on how that approval will work and under what applications it is definitely a little sketchy.
Yeah. So to clarify, that's something, even to explain what it looks like, that's still something that we have to wait and see.
Kinda, yeah. So I'm a little more confident in being an educational event, that it'll probably be okay since the standard is still in a misleading way.
Yeah.
But, and since the standard is marketing in a misleading way, but again, sub-regulatory guidance, CMS will clarify, again, this is what they said, but they'll tell us what they mean later.
Yeah.
On my business card, I say your local expert for health insurance and Medicare supplements. Is that okay? So you don't actually mention Medicare Advantage or Part D in that particular tagline. In general, things like expert are considered superlatives since they can't necessarily be substantiated or backed up by independent data. I'm not for a minute saying you're not an expert, Barb, but CMS doesn't always view it that way. And typically we advise heavily against using words like expert on your business card for that reason of it not being a permitted superlative. If anyone who's contracted with United Healthcare, you can look through your agent guide and it actually has a list of approved agent titles. And that's kind of what we base a lot of our guidance on. It doesn't mean it's exhaustive or exclusive or that there aren't other things you could call yourself. But expert is one that I generally steer people away from. If an insurance company says they have the largest footprint nationwide for a particular type of plan, can we say it? If they have said that in an approved marketing material, yes, you will be able to say that because it's part of an improved marketing material. But the caution I would add to that is marketing materials are approved as a whole document or as a whole piece. It does not mean that a single statement pulled out of that document would also be considered approved or permitted. So the only thing I would caution there is making sure we're using an entire marketing piece, not just pulling pieces out of it. That kind of cherry picking of information can get us into trouble at times.
Yes. So this is kind of a question along the lines of something that we just talked about. But if we decimate brochures with the Medicare card picture on it, what happens if we can't collect them all from everywhere? We have distributed them by the deadline. So I put out these marketing materials. They already have this stuff on it. What happens if I can't get them all back?
Yeah. So no one is asking you to raid your client's fridge and pull stuff out from under magnets, but definitely. Here's the deal. If you already have pieces like that are created, definitely be working with us to go through the approval process. And I want to give you a little bit we'll do an entire another video on the marketing approval process. Approval of marketing pieces for 2024 plan year. So for this coming AEP will basically not occur until around the same time AHIP comes out. CMS has a deadline where you cannot submit new plan year marketing materials until after a certain date.
Okay.
So start working with us, and I would say like May, June is a great time to start working on your marketing pieces, developing everything for AEP. That way by say, this is an arbitrary date. I don't know the exact date yet, but say by July 1st, we can be like ready to send it to carriers. So we can start going through that process. And again, anything using that Medicare card is going to have to be approved based on what we've seen so far. Again, sub-regulatory guidance may be a little more clear on that, but right now I would say absolutely, don't leave those out in the world after, if you got piles of them at a doctor's office or something like that. Definitely need to make sure those are not sitting there come September 30th.
So let's see. Will the limitation on advertising benefits in areas where not available apply to cable TV ads that are nationwide?
Yeah, Linda, that's really kind of the big takeaway from that entire section of the rule is the whole idea here is you should not be using national advertisements to advertise benefits that are only available in the example of the $144 give back, like 6 counties nationwide. So that's really, it will catch a lot of other marketing that is maybe a little unscrupulous as well. But this is exactly the kind of thing that this particular regulation was meant to kind of curb or roll back. So hopefully we will see a lot fewer, or at least a lot more localized ads maybe, and then hopefully the ads we do see are a little more generic in nature or a little more clear. Seeing things about name changes, if I'll paraphrase, if my business name or agency name or license name includes the word Medicare, do we need to change? At this time, no. Again, the big thing here, the word Medicare cannot be used in a way that may be confusing or misleading to a beneficiary, that might cause a beneficiary to think that you are employed by, endorsed by, or somehow in cahoots with the federal Medicare program. So it does not mean you need to change your name unless you're licensed in Florida. Florida does have a prohibition on having Medicare in your license name starting July 1st. If you currently have Medicare in your license name and are licensed in Florida, your license will be terminated on June 30th unless you file to change the name on that license. Reach out to the Florida DOI for more information on that, or us.
Yeah, or us. We're happy to work with you on it.
Of course.
So if a marketing document does not mention any carriers or plans, does it have to be approved by CMS? I feel like we're going to be getting a lot of questions about this, because how it was last year, the definition of marketing material per CMS is changed. Some of those lines are changing a little bit now.
Yeah. So Kelly, the big thing here is, what is marketing? So my recommendation still, as always has been, if you're using anything to market your business, send it to us. Let us take a look at it. It may not be a marketing piece by CMS definition. It may be a communications piece, meaning it does not have to be submitted for approval. But strictly not mentioning carriers or plans is not the silver bullet that it used to be, because if you're mentioning benefits in any way, you're now required to mention carriers. So you see what I mean? The whole idea here is really to draw more things into that bucket that are marketing, to make sure that CMS has more oversight of what's going out to beneficiary. Can we say that 9 out of our 10 clients have selected ABC plan and give the details of that plan? Of course, if the 9 out of 10 is true, Julie, that's a really good question. That's one of those interesting things where you may run into some issues. Why don't you touch base with me directly on that one? Because my concern there is sharing that kind of beneficiary information on a localized level. It's not really representative of the entire market, since it's just your clients. So you can absolutely say your clients do that, but I think the concern there is it may not be representative of the entire population in that area. It may also, I'm a little less concerned about like HIPAA and privacy concerns of people knowing what plan your clients are on. But inadvertently, if they see someone in your office waiting room, they know there's a 90% chance they know what plan they have. It makes me feel weird is my only concern.
That's
on the disclaimer, does the 12-point font requirement number of orgs plans apply to the email disclaimer? Yes, you will still have to have that in your email disclaimer in 12-point font. The whole number of plans, number of orgs thing, man, this one's going to be a doozy. Again, we're going to have to wait on sub-regulatory guidance to make sure that we are doing that correctly or in the most efficient way possible. I really don't think we're going to have to change our signature line for every email we send, depending on where the client lives, but we shall see. Let's see. Norman asked, plans going to be required to give the out-of-pocket on plans? They're definitely required to publish that information. I'm not sure if you're asking, Norman, perhaps are they going to be required to state the out-of-pocket like on advertisements? Like if they're going to advertise any benefits, they also have to advertise the out-of-pocket. That's not currently a requirement, but it is of course required in the summary of benefits and the other plan documentation. So it should be pretty clear and easy for people to see. For the disclaimer requirement to insert number of organizations and or plan to extend to the email disclaimer, we already covered that one. Michelle is asking, can you show up at a client's home? Well, as we have discussed, not without a prior appointment. Make sure you're getting those appointments booked before showing up at someone's home. If it is a current client, that may be a little different, but call ahead. No one likes unexpected house guests. Contrary to popular belief, even our Medicare beneficiaries may want a chance to tidy up or put on a nice shirt before someone steps into their home.
Sure.
So,
Yeah.
so just call ahead. It's not that difficult. Educational events, can we have permission contact forms on the table? This is going to be another one of those sub-regulatory guidance things. D right now, it simply says, on request. I suspect, again, looking back to like pre-2018, 2017 and before rules, probably will not be able to pass them out on the table. That was something specifically called out in CMS's discussion, is that people would pass these out and then watch to see if beneficiaries filled them out or not. I suspect you will not be able to have those on the table. You will be able to have them available, and if someone requests one, you can provide one, but you will not be able to probably just pass them out as part of your information packet or so on or something like that. What if the educational event is specifically to prevent original Medicare education, not Medicare Advantage? Can they schedule an appointment with the attendees? No. Again, educational events have always been specifically Medicare education, not Medicare Advantage plan, any specific plan or documentation. Still cannot be scheduling an appointment with the attendees. I know the argument people are going to give me is, well, what if I'm talking about MedSup? And that's great if you're in Western Wyoming, where the majority of people have a MedSup. But if you're in most of the US, where there are almost twice as many people on Medicare Advantage plans than there are on Medicare supplements, it's a real tough sell to say MedSup was your game plan unless you're not even contracted for MA and PDP. Can you announce the plan presentation meeting the next day at an educational event? I'll get back to you on that one, Julie. That's going to be sub-regulatory guidance that could be considered, guiding or leading or steering them. Definitely a possibility, but again, sub-regulatory guidance on that one is kind of what we will wait for. On the BRC cards, business reply cards at educational events, can they indicate on the form to request an appointment request? The business reply card or PTC is already a request for you to contact them about an appointment. If you're asking, can they put a date on it? No, you cannot be setting appointments on that BRC. It's just permission for you to call them in the future. Any idea if the scope of appointment pro forma language will change? No, not yet. Every year CMS approves the carrier scopes of appointments as communication. So we'll see what they come back with, if it's anything different. But in general, I expect it to say largely the same. Someone say, please clarify the walk-in requirements for scope of appointment. Someone has to walk into your physical office, pharmacy kiosk, or similar physical location for that 48-hour rule to be waived. If someone calls you and says, hey, I need to come in, you can say, well, I can't set an appointment, but you can just walk in tomorrow. I really don't recommend that. That's something someone said yesterday. Don't do it. For real, true walk-ins, I promise eventually carriers will catch on, and that's not something you want. If you're scheduling a call with a client, do you need a scope 48 hours prior? If it's a call to go over any plan benefits, present a plan, or take an enrollment, then yes, you will need a scope 48 hours prior. Not to the call to schedule the call, but you do need that scope 48 hours prior to any plan presentation or enrollment. Are there ways to do a generic scope, including voice scope without a carrier? Yes, of course. Sometimes you don't know what plan you'll sell until you meet with them. Absolutely. There are dozens of generic options. Medicare Center offers a generic option through both text and email. Anyone who has call recording in the appropriate scope of appointment script can do a voice scope over the phone. There are a lot of generic paper scopes out there. United Healthcare's is typically unbranded in a generic scope. So definitely plenty of options there.
And correct me if I'm wrong, but a carrier has to accept any scope of appointment, right? It doesn't just have to be their scope.
Yeah, some of them will complain a little bit, but a scope is a scope is a scope.
Yeah.
It doesn't matter whose logo is on it or if no logo is on it. If it's a valid scope, it's a valid scope.
Sure.
Let's see, telephonic call-in, SOA for telephonic call-in presentations will be 48 hours. Correct. There is no, if someone just randomly calls in, 48 hours unless they're in the last 4 days of that enrollment period. Or again, an in-person walk-in. So just a random call-in, still have to follow that 48 hours. Let's see. Can I scope my clients in September and still have it valid by 12/7? Yes and no. As we've already stated, scopes can be good for up to 12 months. Doing it in September is a little sketchy because you're probably having AEP conversations before you should. But one really easy thing to do is when you meet with your clients this AEP, fill out a scope for next year and you got one. Not a big deal.
Yeah.
12 months. They're good for 12 months. Just make sure you're doing that.
But once you meet, you sign a
Correct.
scope and then you meet,
Yep.
then you have to re-sign another one. But if you haven't met in those,
12 months.
12 months,
Yep.
then it's still valid.
Yep, absolutely. Someone calls your office to get information or enroll, not walk in, but call in. You have to say, I need a scope and call back in 2 days. Yes. Yep. As we stated before, does not apply to call-ins. So can we still use a paper scope if we have clients call in for an appointment to send it out and then most carriers will take it? Absolutely. You can still use paper scopes. No issues there. Do we still need to record in-person enrollments or only on phone enrollments? Martin's, there was never a requirement to record in-person enrollments. It is only phone sales and enrollments that need to be recorded. Put the checklist in a link here. The checklist, Barb, will be going out in the post email. I'm sorry, if you're referring to the pre-enrollment checklist or the CMS checklist, those will come out as part of carrier materials or in the sub-regulatory guidance. If you're referring to the kind of quick fact sheet that we put together, that'll go out in the post email.
And also what he's been using for a lot of this, when he said like, oh, we're on number 8, that's the Federal Register document.
Yep.
And we have that listed in the questions. You'll see a link somewhere in there, but that's what we've been referring to.
Yep, absolutely. It'll be helpful for SMS to provide a job aid or training on impact of other coverage when discussing MA plans to satisfy pre-enrollment checklist requirements. Absolutely agree, Linda. I will say that a lot of that's going to be carrier by carrier. They will still be developing those pre-enrollment checklists and including language in there that you'll be required to cover as a part of that pre-enrollment checklist. So while we can obviously provide general guidance and go through those with you, it is going to be a carrier process, not potentially a single unified one. I suspect they'll be substantially similar carrier to carrier. Sales meeting presentation. Do you need a scope of appointment? Are we talking registered sales events, Rodney, or what are we talking about? Maybe clarify that for me, and I'll check back with you in a moment. D made the comment, it would be nice if the summary of benefits shows what does go towards the max out of pocket and what does not. I absolutely agree. You get right on that, D. Call CMS up and raise heck with them. I'll support you on that one.
Yeah.
Where is the document that we're following? Again, Connie, the main document there, we're reading my legal pad notes right now, but the main document is on the Federal Register. It is the 2024 Medicare Program Contract Year 2024 Policy and Technical Changes for the Medicare Advantage Program and Medicare Prescription Drug Plans. Missed the first 20 minutes. Where do we find the new ruling? Just went over that. And again, we'll email this out shortly. Do we start using the new disclaimer on 10/1/2023? Michelle, that is a fantastic question. And the answer is no, you start using it on 9/30.
Yeah.
Again, they rolled it back 1 day this year. And again, I suspect that was because you had a lot of folks maybe going out 5 p.m. on September 30th and dropping a bunch of stuff in the mail, or maybe even on October 1st saying, well, was it inclusive of 10/1 or exclusive of 10/1, and trying to get away with some things. Got several comments here about number of plans may change based on the county people live in. You don't always know where someone is until they call in. Again, that's going to be all sub-regulatory guidance, folks. Definitely big questions. to look at later this year when CMS comes out with that. And I also want to clarify too, like it may seem like this rulemaking process is over, but it definitely isn't.
Yeah.
Right now, CMS has put this out. There's no official comment section like there is when the rule was proposed, but definitely still, work with your organizations like NABIP, work with, any other trade associations, work with your, local carrier reps to provide feedback, because as CMS develops sub-regulatory guidance, that's what they're looking for. Okay, you've had time to read this. What's still confusing? What do we need to clarify?
Yeah.
And that's what'll come out in sub-regulatory guidance. So don't feel like this is over. Again, as we said, it's not like any of this is going away in all likelihood. Very, very, very small chance any of this would ever go away in sub-regulatory guidance. But if there's something that's unclear, again, work with, National Association of Benefits and Insurance Professionals. They're a great advocate for us. They provide a lot of commentary on things like this, and that's how we'll get the sub-regulatory guidance that we need.
Yes, I love that. I think that, yeah, exactly what you just said. I think sometimes it can feel like all the stuff is changing, it's changing so fast, like you can feel maybe a little bit helpless, but you do have those organizations where you're able to talk with other people that do exactly what you do with the same sorts of people, and it gives you some sort of voice or some sort of, group to talk about this stuff with, and maybe give you a little bit of hand in some of that change and stuff. So definitely join one of those organizations if you haven't already.
Yep. Absolutely. Yeah. Absolutely. Group sales meeting presentations. Do you need a scope before enrolling multiple beneficiaries at the meeting? This is from Rodney. Thanks for clarifying that. So traditionally, and again, we're talking back like pre-17, the whole point of a registered sales event was that you could enroll someone right there at the meeting without having to worry about the 48-hour rule. So I suspect that will be substantially similar or the same. Again, we're basically rolling back the clock to 2017. Sales and educational events are going to look very much like they did prior to that. Sales events are registered sales events other than, say, a kiosk, a pharmacy kiosk type thing. Definitely want to be working with your carrier partners to choose which plans to represent at those sales events, and definitely want to make sure you're following the rules. And again, expect carriers to release new guidance on all of this as well. The CMS rules are kind of the bar. It doesn't mean carriers can't set a higher one. That's the big call out here.
Yeah.
Review the rules for radio. Absolutely. So conversation-based advertising, Aaron, absolutely, please reach out to me. We may have to have some discussions about that. Definitely a lot of interesting rules for if you have an actual radio show or an interview. A lot of those are going to be carrier-specific rules about how you represent their plans on the radio. And again, with these new disclaimer rules, may change some of that as well. So reach out to us directly for some conversations on that and maybe what specific questions you have. Definitely a good thought process though. Pre-enrollment checklist be a CMS requirement. Yes, pre-enrollment checklist as stated is going to be a requirement for all telephonic enrollments. You'll have to go through the pre-enrollment checklist and get an affirmative response on it. And then for in-person, you'll just have to provide that pre-enrollment checklist with the other enrollment materials. And yes, it will be all carriers. Michelle, great on you. You record all calls because you never know when things will change. Definitely a good idea. Watch your data security. This has always been the concern with call recordings. Make sure that you've got a good data privacy and security plan in place. Possibly invest in some cyber liability insurance. Make sure you've got a good IT team to back up your data storage and make sure that it's protected in a HIPAA compliant manner.
Yeah.
If you're discussing the basics of Part D plans or Advantage plans without carrier info, does that call need to be recorded? Again, still kind of recommend recording all calls because you never know when something might transition to a sales discussion. But in general, if you are having an educational call that does not talk about any specific benefits, any specific carriers, any specific plans, if you're only going over the basics of, and when I say the basics, I want to be real clear for everyone. If you read the Medicare and You handbook and it has a section there on what is Medicare Advantage, that's the basics. In a time where we're looking at more and more secret shoppings, that's what I would expect to be able to get away with, in terms of what is education. So it's going to be extremely limited. Yes, they're private plans. They have networks, things like that. but definitely no specific benefits, even types of benefits I would avoid
Right.
without a scope of appointment. Definitely going to get a little more strict.
Mhm.
What if you are selling and enrolling on the phone? Lib, if you could maybe clarify that.
So that was a follow-up question earlier, I think, whenever we were talking about the 48-hour rule.
Oh,
sort
gotcha,
of
gotcha. Yeah. So again, if you're on the phone, 48-hour rule absolutely still applies. I'm going to need that scope 48 hours beforehand, and unless one of the exceptions applies.
Mhm.
Can we revisit whether the disclaimer has to be read on service calls or just the sales and enrollment calls? Hey, Julie, they didn't clarify that one directly, but given that the requirement to record now only applies to sales and enrollment calls, I strongly suspect that is where that disclaimer will be required as well. Linda, thank you so much for calling out my jargonism. What is a TPMO? TPMO is a third-party marketing organization. This is a new definition that CMS created, and it's basically anyone who gets paid as any part of the chain of enrollment, which is from the time someone becomes aware of a plan to the time they enroll in a plan. So that includes things like marketing organizations, lead vendors, as well as agents, carriers themselves, and anyone in between who is paid for any marketing or enrollment-based activities.
Mhm.
How long do you have to retain paper copies of sales and enrollments? It doesn't necessarily have to be a paper copy, but all materials pertaining to an enrollment may need to be retained for 10 years, just like a scope of appointment, whether that is in paper form or electronically. I do not offer MA or Part D. I won't need to worry then. Barb, if you are not contracted for Medicare Advantage or Part D, then yeah, a lot of this doesn't apply to you. I would definitely have a conversation with our outreach team about why you probably should be offering Medicare Advantage and Part D, given that there are twice as many people on Medicare Advantage in the US right now as are on Medicare supplements, very close to twice as many, and that all of your Med Supp clients still need a Part D plan, or at least the vast majority do. So definitely a discussion to have with our team about the pros and cons of getting into that market. Even with all these rules, folks, this is still an amazing market to be in and an amazing way to help the currently 47% of Medicare beneficiaries that have a Medicare Advantage plan. Mail out appointment reminders in September for appointments during OEP. Am I allowed to mail the scope of appointment with the reminder and ask them to return it prior to the appointment? You can always mail out scopes to current clients to get those back in 48 hours. Just a reminder that you do have to have that 48 hours before the appointment in hand. So make sure that they're sending those back in a timely manner, or again, just get used to the other ways of collecting a scope would be my recommendation. Making sure, that you're comfortable with text and email and online and voice and all of those other scope possibilities. Dozens and dozens of ways to get a scope nowadays. Can you use specializing in Medicare related benefits? I'm guessing you're talking about like in a business name or a tagline or something like that. That again, this is going to be a little bit of sub-regulatory guidance, a little bit of carrier guidance that'll come out later. I wouldn't print off 10,000 new business cards that say that by any means, but I wouldn't print off 10,000 of anything between now and say August, unless you plan on having them all used by August.
Sure.
Is it prohibited to use the word Medicare in your business name? Been using Health and Medicare Solutions as my DBA name. Right now, today, no, it is not prohibited to use the word Medicare in your name. We may find out more in the sub-regulatory guidance, but unless you're working in the state of Florida, there is no prohibition against using Medicare in your business name as long as it is not used in a manner that could confuse a beneficiary or mislead them into thinking that there's a relationship between you and the federal Medicare program that does not exist.
So that kind of goes, there's a couple more questions underneath this, because these are all replying sort of some questions that
Sure.
So someone's asking about, can I use Medicare in my car wrap? Can I use it on that word on my website? All of that falls under sort of what he just said. Right now, technically, yes, unless you're in Florida, but hey, we might find out this summer that you can't. So just be keeping that in mind.
Yep, and I do want to address this one. Patricia asked, what is an example of a permissible superlative?
Good question.
There are none. Superlatives are not permitted in marketing, even in taglines and slogans. That was kind of the whole point of the rule this year, was to kind of close that gap. You used to be able to use superlatives in taglines and slogans. You cannot use superlatives anymore in any capacity. And I want to hit this one real quick. Medicare is mentioned in my car wrap. Do I need to remove the wrap? Rodney, that's a great one. Was that your car that I saw in the Senator Wyden Finance Committee report? That was actually something he specifically called out, was someone who had their car wrapped to look like the Medicare card. And again, that's going to be like more news to come with this sub-regulatory guidance. I really hope you don't, because getting a car unwrapped would suck. But definitely a possibility. I wouldn't go buy a new car and wrap it until we know more. In Florida, can your website include the word Medicare? That's a good question for the Florida DOI. Work with us to get a solid answer on that. Right now, the way I understand it is that your license and business name cannot include the word Medicare. Website, again, let's have a conversation about that. Reach out to the agent resources team to talk about that one, Sharon. If you have clients with a particular AOR or agency and the agency changes owners, do those clients go directly to the agency owners? Does the current AOR lose them forever? Linda, that sounds like a question kind of outside of this marketing stuff. It sounds like it's a little more about maybe like succession, business planning. We have an entire team dedicated to that here at Senior Marketing Specialist. Please reach out to the acquisition path-based team or book of business team. They can help you with answering those book of business type questions.
So folks, since a lot of these are kind of doubling up here and we don't want to keep you forever, we are going to kind of start being a bit more picky here. So if you have any more questions, go ahead and throw them in. We still have a lot to go through. But if we, don't get to your question or whatever, that's totally okay. Please feel free to call us after this. You'll be receiving a follow-up call. So we're able to answer questions. We do not want to avoid any of your questions. We want to make sure that you get all of this clarified. So if we don't hear in the next few minutes, please feel free to call us. So let's see, there we go. That's a good one.
Perfect. Only 2 of our employees sell Medicare Advantage plans. We have the disclaimer at the bottom of all of our emails. Do our other employees need to include the disclaimer in their email signature? If you're talking about employees who do not offer and are not contracted to offer Medicare Advantage plans, no, I wouldn't think so, unless they're going to be, if they're going to be communicating with your Medicare clients about other lines of business, I would still recommend adding it. It's not a big deal. It's in the footer. People aren't going to really pay attention to it, in my opinion. We really saw no increased friction from agents over the past year. Having it in the footer should be a pretty easy fix, just to kind of keep you safe. Great question from Frank. Where are the rules in the Federal Register? If you just go to federalregister.gov, that's where I highly recommend everyone start. You can actually subscribe to that and get updates from certain federal agencies anytime something is added to the Federal Register. Just hop on the homepage, scroll down to the list of agencies. You'll want to hit HHS, Health and Human Services, of which CMS is a subsection of, sub-agency of, and then you can go through everything that CMS has added to the Federal Register over the years, including this final rule. Just wanted to confirm, appointments going forward in this new ruling are not required to be recorded. Rita, if you're talking about in-person appointments, there was never a requirement to record in-person appointments. Phone appointments do still need to be recorded. Zoom, Ring Central, online meeting type appointments do still need to be recorded. So any plan presentations or enrollments do still need to be recorded. I actually want to go back up to Julie's real quick. I know you're wanting me to be picky, but so scope was sent to them, but they failed to get it signed in advance, even though the correct time was allowed to do so. Do we have to turn them away? Julie, yes, you will. It's on you as the agent to confirm that that was signed appropriately. If you're talking about using some kind of online system, you have the ability to go in and check to see if that scope was completed. So that's going to be on you to check and make sure that you got that scope returned to you in a properly completed fashion 48 hours before the appointment. So again,
so it's not just sending them, it has to be signed.
You have to have it signed within 48 hours. minimum 48 hours in advance. Let's see, Medicare app voice scope compliant yet. If you're talking about like a voice scope script, there is a pretty standardized voice scope script that is approved, and regardless of what recording platform you're using, it will be compliant. You'll just need to be able to, retain those for 10 years, pull them if you're requested by a carrier, so on and so forth. Does the 48-hour rule apply to current clients? Absolutely it does. It applies to anyone that you are enrolling in a plan. Another question about generic scopes. Yes, generic scopes are fine. D mentioned, I suspect and hope AHIP will cover a lot of this. Yes, AHIP is updated every year to cover any new rules and regulations you can expect. It's usually section 4 of AHIP that goes over marketing. It'll get a little bit longer this year, just like it did last year. And on that note of AHIP, I'd love to make a little plug for, again, NABIP, National Association of Benefits and Insurance Professionals, does have an AHIP alternative certification that is accepted by the vast majority of major carriers. Aetna is kind of the only holdout amongst the big carriers, and they're currently, obviously working on trying to get approval from them as well. So definitely consider that. It's a little cheaper than AHIP and goes to support NABIP's lobbying efforts on behalf of agents everywhere. Let's see, current client calls with a service question. We do not need a scope of appointment to answer that question. If a client calls about something to do with their current plan, you do not need a scope to answer a question to help them order a new ID card, find a doctor on their current plan, something along those lines. You would need a scope if they want to discuss any new plan options and that 48-hour wait as well, if they were calling in, not if they walked in. Lots of wonderful thank yous that make me feel like the hours and hours I spent pouring over all this was worth it.
Absolutely.
Let's see. So we could send out a scope today for 2024 enrollment period. That is correct, Susan. You could do that. During service calls, do I need to read the disclaimer in its entirety, or just say we're on a recorded call? Or again, read it. That's going to be a sub-regulatory guidance thing with the requirement to record only sales and enrollment calls going into effect. We'll get back to you on that one when we have the sub-regulatory guidance. Again, we're talking later this summer. I don't have a timeline. It'll just be whenever CMS gets to it. I think we've already addressed generic scope of appointment.
So Anna is asking, where can we find a generic scope? I know that we have one on our website under the MAP toolkit. You can find one there. We always have that. And then, like he said, the United Healthcare scope.
Paper scope.
Yeah, the paper scope should be generic.
So the text and email ones that Anna is referencing, Medicare app can do all that for you.
Yeah.
So hop into Medicare Center, get familiar with that. It is not tied to a specific carrier. It is a generic scope of appointment. There's both a text and email option where the client can sign the link through their phone or email.
Yeah.
But those are entirely generic as well. Can I say independent Medicare agent? Recommend against that. That's one that I get a lot of pushback on from folks. Saying you're a Medicare agent is definitely something that I think could be considered misleading, since you do not work for Medicare. You are not an agent of Medicare. So saying you're a Medicare agent is definitely something that I would avoid in business titles. Will this affect the CSA designation? I assume you're talking, Michelle, about certified senior advisor. That was always a really kind of sketchy designation that was never recognized by CMS. Several states have already prohibited the use of the CSA designation, and it was not something that I considered particularly useful in a lot of ways. Not that the education was not incredibly useful, but the designation itself was not super useful, since it wasn't really approved by CMS or usable by a lot of agents. Can I explain what I mean by superlatives? Yes, Samantha, that is things like best, most, largest, smallest, lowest, highest, any of those kind of qualifying adjectives that might describe a plan's performance or benefits or networks, or even you as an agent, best agent in the Tri-County area or something like that, anything that is not substantiated by data. So again, you can say that we have the largest enrollment of any plan as long as you can back that up with data. CMS clarified that that needs to be data from this year or the prior plan year if you're going to use that. You must record when someone calls in and says, I want to set up an appointment to come in and talk to you about Medicare. Lib, starting September 30th, no, you will not have to record that, that requirement to set an appointment. Only sales and enrollment calls, only plan presentations, and the actual enrollment. When does the 48-hour rule begin? September 30th. So if you're meeting with people on October 1st, you need to make sure you've got a scope of appointment signed no later than September 29th.
Which you can start doing now.
Which you can start doing now, because that 48-hour rule is going to be based on when that meeting occurs. Sometimes they just ask for an in-person appointment. I don't know exactly what they want to talk about. Lib, definitely understand that. Get a scope of appointment. Millions of ways to do it. Super easy. Make sure you are prepared. Also gives you an excuse to ask them, hey, what do you want to talk about?
Yeah, that's true.
I would say just from a like time perspective, your own time and sanity, don't set appointments if you don't know what they want to talk about. Great chance and opportunity for you to make sure that you're both following the rules and finding out what they want to discuss before they get there. And let's see here. Some more amazing thank yous that do my heart good. Local Medicare resource, that's 1D that we may have to talk about. Again, my concern is that could somehow imply that you are sanctioned or endorsed by Medicare. That would definitely be problematic in my mind. Send out a plastic cover for new clients to put their Medicare card. If we put a blank Medicare card in there to show them what it's used for, is that okay? Sue, I would say that's probably not going to be okay without prior approval from Medicare as referenced in the final rule. No use of the Medicare card without prior approval. Again, we don't 100% know what that prior approval looks like yet, but we'll get back to you as soon as we do. Confused a bit if we can't say Medicare in our ad, how will they know what we do? D, definitely no prohibition against saying the word Medicare. Just have to make sure that we are using Medicare words, marks, logos, terms in a way that is not confusing to a beneficiary, that could not imply that you work for or are endorsed by the federal Medicare program. And as hard as it is to believe, I think that's all the questions so far. So last chance, hop in with some questions if you have any. Otherwise, of course, you can always reach out to us here at Senior Marketing Specialists, and we will definitely. Oh, we got a couple more.
Yep.
Of course we do.
I knew it.
Someone was just waiting. I'm super excited. I hold annual AEP meetings for my clients in a group setting and go over changes to plan. Do I need them to do a scope of appointment? And can I set an appointment for a later date at that meeting? If you are doing a registered sales event to go over an ANOC or annual notice of change with your clients, you would not necessarily need a scope of appointment for that registered sales event, and you would be able to set appointments. If this is an educational event, which frankly it can't be if you're going over an ANOC because you're talking about specific plan benefits. So if it's a registered sales event to go over ANOCs and plan changes, it would need to be registered. It would need to be a sales event. You would not need the 48-hour scope, and you would be able to set appointments. Thank you all so much for holding on with us through this very long webinar, which has been fantastic.
I love this comment. It says, so very glad we do not have to navigate these changes alone. Thank you, Chalen. Truly.
Listen, they said Chalen, Sadie, and all SMS employees. Well, Sadie's just being incredibly generous.
To be fair, there aren't a lot of Chalens out there.
Oh, thank you.
So it's like, it's incredible that our team has, you can get it directly from a compliance officer. So that's why it's super exciting that we're able to have this webinar with you on here. And again, if you missed some of it before, We will be putting out more content on our YouTube page. We'll be sending you guys stuff to make sure that you're in the know. It's not just going to be a one and done, presentation. You'll be seeing Chalen a whole lot on our
Yep.
YouTube page to make sure that you all, as we get information, we will be giving it to you. So definitely be keeping up with our YouTube page. Make sure that you're answering our phone calls and looking at our emails just to make sure that you aren't missing anything. But, you'll be hearing a lot from Chalen. So.
Absolutely. Thank you all so much for hanging with us. I'm not seeing any more questions, but again, reach out with anything you have, and we may not know the answer today, but we will by AEP, and we'll get them to you as soon as we can.
Absolutely. And for the couple people asking, yes, today was recorded. So this will be in our follow-up email that you will be receiving. If you registered, you'll be receiving it, even whether or not you attended the whole thing or not, don't worry. Also, the federal registrar document that we were talking about, plus the document that kind of a FAQ thing that senior marketing specialists put out, those will be in the follow-up email as well. So everything that we referred to today, that will be in the follow-up email. And we'll make sure you have all the stuff that you need to feel as comfortable as you can nowadays. And of course, we're always available by live chat, email, and call. So yeah, any questions you have, feel free to ask. Thank you guys so much for joining us today. We know that this one was a doozy, but hey, Chalen put in all the work, so that way you don't necessarily have to go through all of that yourself. So happy that you joined. Thank you so much. And we will get you your day back.
Yeah,
awesome.
Absolutely.
Thank you guys.
Thanks, y'all.